Hi, good morning. So, this is our first podcast, and right now, the world is dealing with a pandemic. And we have here two of my friends. We have someone from the US and someone from France. So, say hi.
Hi Joyce,
Hi,
bonjour.
Tony. Hello, hello.
How are you? It's been ages since the last time we saw each other. I think
Yeah.
it's in a bar in Quezon City. If you
In
remember
a bar.
Saimaka?
Yeah,
Yeah.
yeah. Okay.
In a bar.
Yes. So for everyone's information,
What are
so
you guys
Brian is
doing?
my college friend, and Brian, this is my best friend. This is Tony. So
Hi
yeah,
Tony. Hi.
Hi. Hi.
Nice to meet you.
Hello.
she's currently in the States, so she lives there, and we're going to have three perspectives of what's happening. So many things that we can discuss. Let's start. How are you personally dealing with it? Who would like to start? Tony,
Ladies first.
Ladies first.
how are you
Okay.
dealing with it right now?
Uh,
How has it been personally?
I'm getting paranoid. I'm
Uh-huh.
getting paranoid. Every time I go out of the house, anywhere I go, I have to make sure that, I wash my hands.
Mm-hmm.
I wash my hands and sanitizers, alcohol. I'm getting paranoid, honestly.
Mm-hmm. How about work?
That's one. And work, um, well, everyone is working from home. So work is not really affected.
Mm-hmm. Can you disclose where you
I
work?
miss I miss the
Can you disclose
uh,
that? No.
no.
Okay.
I can't.
Yes, let's respect that.
I can't.
Okay, but you're working from home, right?
uh, yes, I'm working from home. Um, uh, and then well, right now, uh, like I've said, work is not really affected.
Mm-hmm.
I miss the free coffee, the free meals.
Mm-hmm.
That's what I miss.
Mm-hmm.
Yeah, that's it.
Mm-hmm. How about you,
Work is the
Brian?
same.
Are you still working?
Well, yes, I work, but actually for me there's no other way to deal with it but to face the situation. But
Mm-hmm.
more than that, I'm actually more worried with my family back home in the Philippines
Mm-hmm.
because I've been away for like 4 years already, and yeah, so I'm thinking about their situation
Right.
there and me being absent,
Right.
physically speaking.
Mm-hmm.
So it's really a difficult situation for me,
Mm-hmm.
especially not even before this pandemic, the volcanic eruption in the
Right.
Philippines
Mm-hmm.
and
Mm-hmm.
Oh
a
yeah,
lot of
yeah.
so
Uh,
that's what's bothering me
Right.
more
Right.
than my situation here in France.
Mm-hmm.
mhm.
But how has it been there?
So
So, personally, how are you stocking up on food? Like me, you know what we need to stock up on? Pancit Canton. Okay, so there's Pancit Canton.
okay, yes,
There's
yes.
the sardines. So
Mhm.
the first things that we need to make sure we have are medicine and food and well, for me because I have asthma, my
Nebulizer?
the nebulizer. So the nebules. So they call. I had to buy my nebules because I don't know
Ah,
what's going to happen.
okay.
And so I'm high risk. That's why just can't leave.
Oh,
I'm asthmatic. So anyway, how has it been there? How have you been dealing with it there,
well,
Brian?
like here in Paris, the lockdown announcement was last March 16.
Mm-hmm.
That was Monday evening, and then the lockdowns started the day after, March 17, midday. So
Ah,
we
17.
have so we only have the morning of the following day, which is March 17, to prepare because
March
actually
17.
yes, that
Okay.
was the start of the lockdown here in Paris. So that
Okay.
around 14 days already since it was announced. So we only had like morning of March 17 to prepare.
Mm-hmm.
But for me, a good thing the supermarket is just downstairs in
Right.
here
Like
in here
here.
in where I live. So
Yep.
Mm,
Mm-hmm.
yeah.
stocking
We
up groceries is
Mhm.
never a problem with me.
we are fortunate to have that,
Yes.
easy access. How about you, Tony? Because I know it's far.
Yeah. Prior to this pandemic, California, we've always had that delivery service.
Right.
So
Okay.
groceries,
Ah.
yeah. So medicines,
Mm-hmm.
we always have the option of having it delivered.
Mm-hmm.
So
Okay.
yeah.
Right.
What I did notice is, people are panic buying.
Okay.
And hoarding.
And
Yes.
hoarding, yeah.
So
How did you deal with that
that's
there?
where the problem,
Let's talk about
the
how
panic
how
buying.
yeah, in your area, in your respective areas, because here, I've seen videos of that, of hoarding, but then when I started doing the groceries, I noticed that, I think because of that, the videos just everywhere posting of people hoarding. They've managed it, in like here the grocery store. You can't just get your alcohol, it's the guard who has to give it to you. So you can't hoard it. I also noticed that they have been replenishing more frequently because
Mm-hmm.
there are a lot of buyers. There's also a line. I like how it's getting organized here. It's more and more organized here. So I'm how has it been there, when it comes to your municipality, your area? How has probably the government, or how is the government dealing with it?
Mm-hmm.
Anything you want to share?
Well,
Well, okay,
yeah. Then go ahead,
okay,
Tony.
okay.
Go ahead, Tony.
I can only speak for NorCal because I'm from the Bay Area. Here in Northern California, our governor is doing a great job. Our mayor is doing a great job. The communities are helping out a lot. Um, the giant techs are contributing
And you're
to
talking
make it
about, when you
millions
say
and
the giant
billions.
tech,
I'm talking about,
that's
yeah,
Facebook,
Apple, Google,
right?
Facebook, Amazon. So we're surviving, and it's a good thing because it means that we don't need Donald Trump in California.
Right. So
Okay,
I
Okay.
think we are
and
getting there. Okay.
we are surviving.
We are getting there now.
Okay.
Okay.
So far, 23 states have issued stay-at-home proclamation, right? So I don't know exactly. I don't have the accurate information about the other states, but as far as Northern California is concerned, everyone is helping out. Uh, Silicon Valley has launched a fundraising campaign, which is Silicon Valley Strong, where people are donating blood and oh man, I have to cut you there. Hang on. So
No,
okay,
it's okay. It's okay.
someone is knocking at my door.
All right.
Okay,
So,
yeah,
what about
okay,
you,
yeah. I'll
Brian?
be right back, guys.
Go ahead, Tony.
Well, you know what? You know what? Here in France, I'm very happy that people are taking this pandemic very seriously. I
Oh,
mean, all
good.
the lockdown measures, this physical distancing. We call it physical distancing here in
Which is a
France.
lot better.
This hand wa yeah, this hand
Okay, so
washing
I'm
and
back.
hello, welcome back.
Yes. Hi.
Yeah.
Everybody observes it. You know, when you go to, like, for example, in a bakery shop, here in Paris we call it boulangerie. So you're not allowed to enter until the three people inside are out. So you have to
Oh,
wait
three.
outside. Yes, because the inside the store there must only be three people.
Right.
So, to practice this physical distancing. That's how serious they are here in
How was
France.
it?
But
Yeah. How hard hit is France right now? Back
yeah,
2 weeks.
right now, right 2 weeks ago, it was less than 1,000 no, less than 10,000 cases, and now we're over 40,000 cases.
Okay.
So I think in the leader in this pandemic leaderboard, France is in the seventh place.
Right.
So
Seven. Yeah.
Oh, that's
that's
terrible.
Okay, now
but
that
That's
made me more.
right.
Europe in general is really, badly hit
Right.
by corona.
And I think that's also why U.S. President Donald Trump had to block the travel to
The
the
travel
European
ban.
countries, right? So let's talk about
Yeah.
there in the States, because Before it was China, but now the epicenter, just like what Brian was saying earlier, the epicenter of this pandemic is now the States. And New
It's
York
the
is always
US.
on the
Yeah.
news every day.
Mm-hmm.
Their their governor, Cuomo, is always there on the news. I like his leadership. But what do you think of how the country or
Now that
the
we overtook,
federal
China and Italy,
And everybody.
and
yeah,
everybody
and
else?
everybody else,
Right.
now United States is the epicenter. That's what happens when you have a president who does not believe in science.
Okay.
What
Right.
can you do?
But
Wait, I'm
Right?
curious. What do you mean he doesn't believe in science?
right.
Like,
He doesn't believe in climate change.
Yeah,
all
You
but
know,
right, I see.
he
how
downplayed the coronavirus.
what is the connection of that to this specifically? So what did he not do or do that led to the sudden rise? Because I
He
think
downplayed it.
okay,
Okay, he downplayed it, and instead of well, there should have been an early preparedness plan
Yes.
about this pandemic. And what I'm trying to say is this: if you already have hundreds and thousands of people infected in another
in other
part of the
countries, yeah,
world,
yeah.
Mm-hmm.
yes, and then you have thousands of people dying. Well, obviously, it's not just an itch that you need to scratch, right?
Yes.
So, I mean, it's common sense. People don't just die,
When did you guys have
you
the
know.
quarantine? Yeah, sorry, go ahead.
Yeah, I was about to ask also.
Yeah, well, when did you? Because here it's March 16, and
In
it
France, it's
coinci-
March 17.
which is almost the same day,
In
right?
Northern
So
Ca-
when was it there?
Yes,
yeah,
yes.
in Northern California, it's March 14, if I'm not mistaken.
In California,
In nor
They start,
in
yeah,
right? But
in
in
California.
Northern California.
In Northern California, or I don't know, I think that's when Trump finally declared three states.
Oh,
That's
it
Washington.
wasn't national lockdown all at once.
No,
no, it wasn't
I
because
see.
Washington,
Okay.
I was reading New York. I was
California, and New York.
correct because I was watching that, and the governor was saying, "No, I'm not going to lock down New York. We're not. I'm not going to imprison." I think that's what he said verbatim. Let's move on. How do you look at there's a surplus, so to speak, of information? Finding out which to listen to, the verification process that you have to go through. Yes, Brian.
Oh, you mean
With
like
everything,
this
yeah.
information?
Yeah, when it comes to the virus itself, I think we know where to go to, right? There's a CDC, there's a World Health
Yes,
Organization. We have our own for every country, but then we look at social media, we look at other articles. There's this medium now, a platform for other people to sort of advertise what's been happening to them personally.
Are you
And
talking about misinformation?
yes, fake news, so to speak.
Or
Oh, you mean the
Yeah,
proliferation
or
of
misleading,
misinformation?
misleading.
misleading information
Yeah, we don't even know.
or information overload.
Yes, that's another one. Just like us here at work, one of my the CSAs that I handle forwarded a screenshot of an announcement supposedly saying that they're shutting down this entire building because of this and this and that. There was a positive case, which is not true. But that, of course, the effect of that is the people working
Yes.
there would not work. Then I had to verify. So that's one thing. It's a very emotional time right now. It's like a polarized state right now, which is also happening in the States, right, Tony? Aside from the pandemic, we also have that because sometimes it's just too much fighting. Yes,
Well,
Brian.
actually, here in France, contrary to what Philippines is doing,
Right.
shall I say, we treat it as a health issue, not really a political issue. Or maybe that's France in by nature. French people are not really too political. They are more scientific actually. So they're treating this issue, this pandemic issue, as more of a health problem, and they're putting aside their political preferences. So that's why the moment the President Macron announced the national lockdown,
Oh, I
everybody
like him.
Of course, you like him.
Just
Look at
saying.
his smile.
everybody followed. So I think for the Philippines, that's what people should do. Also, they have to follow because it's not, it's for everybody's good.
Right, right.
Politics would just do harm,
But
more harm than what this pandemic does.
I think that you and I have the same stand where you are free. You have every right to say what you want. You have every right to oppose something or
Yes.
what the government does. But I also think that I also would like to more or less highlight how we can, propagate, let people know more about what's really happening and how we can help and how things are being done. During the first week of the enhanced community quarantine, there was a daily report from the interagency task force. And I think you've seen that because it was also heavily discussed. All those press briefings of the president, of President Duterte, and of course his
The
members.
DOH officials.
Yes, yes, how they were answering questions and all those. So now it's become just a weekly report. I don't know if it was able to push through earlier, but it's now going to be a weekly report from President Duterte. Right now, my problem with what's happening is we lack more details, information, updates. Although there are updates, but I think we're getting more information from those reporting
Social
what's currently
media.
happening. The doctors, complaining, the health workers complaining. That's what we hear more. And of course, we have the Department of Health. There's always a press briefing of a report, which is, this is a current count, positive, the PUIs,
Yes.
the number of the PUMs, and then this is the number of kits. So I think we need more information on I think a thorough, a comprehensive layout what has been done. So I'm looking forward to that a weekly report. We're also very anxious about what's going to happen to our lives because this is just supposedly until April 14th. So we're workers, we're employees, right? So apart from us thinking about how we're going to get paid, the financial aid, we're
Okay.
also looking at what happens after April 14 because then the numbers are just starting to go up because it's just now that
Oh,
we're
yeah,
starting
yeah.
to get tested and we don't even have enough. So there's also this hashtag mass testing,
Mass testing.
yeah,
Yeah, yeah.
right. But I
Yeah.
think it's also happening everywhere, right? We want more people to get tested.
Yes, of course. That's actually one of the solutions here. Everybody has to, be aware that they have it, and so the government could take measures on how to treat these people. But
Uh,
you know what? Here, the lockdown is supposed to finish tomorrow, but last
oh,
Saturday
it's
the
tomorrow?
extension. Yeah,
Right.
yeah. But the last Saturday, the extension was announced, so it will be until the 15th of April, and we don't know if there will be another extension come April 15.
Right. What do you think?
Well,
Have you
here,
guys been doing mass testing there in France?
In France, oh, I don't know. Uh, there are enough kits here in France, but when it comes to mass testing, no, I don't think they're doing it right now
Okay.
because the protocol is when you have, for example, if you are a PUM or a PUI and you have symptoms, but the fact that you're still a PUI or PUM, you're not, you're expected to just do home quarantine.
Right.
So, but if it's mass testing, you have to, the government has to immediately test you. So I don't think mass testing is being implemented here now.
yeah, same here. Same here
It's
in
not.
same here. No, it's not.
But
Although
you guys
testing
are
is now
calling
more
for it.
widely available.
Right, right.
Um, no, with us here, you have to go online and they check or you have to answer the symptoms that you have. And if
Uh-huh.
they can, yeah, they determine it. And if they can determine that you're, just like what Brian said,
Mm-hmm.
PUI, you are, not eligible for testing
I see.
right
Okay.
away. They
Mm-hmm.
Yes,
usually
so
Mm-hmm.
they
it's the
usually
same.
recommend that you stay at home,
Mm-hmm.
isolate,
So it actually is happening
yeah, self
worldwide.
quarantine.
Our call for
Mm-hmm.
this, there's just a glaring reaction to the fact that we're not getting a lot of people tested. There's like, was that hashtag no to VIP testing. When you go to the Philippine news, you will see there the politicians, the pictures holding the
Mm-hmm.
sign, and
But you know, but you know, yeah, but you know, I think in Germany they're already doing mass testing. I can see
oh,
videos
that's
of
why. That's why they're applauding
yeah,
Angela Merkel.
yes. And you know what? In Denmark,
Yes, Tony.
I
I think
heard,
Tony has to go again. Is it your dog again?
yeah,
She's disappearing sideways. Yeah, go ahead,
yeah.
Brian.
In Denmark, I heard that the national government is distributing test kits to all their residents via mail. So they mail the test kits to all the residents of
Right.
Denmark,
Mm-hmm.
and then so the people are being instructed how to
How to use
use the
it.
test kit. Yes,
Oh, like
and when they have
Iceland.
when they yeah,
The
really.
swabs.
So
Yeah.
and then afterwards they have to submit
Like
to
send it
mail
back.
back.
Right, right.
Yes, send it back. Yes.
Oh.
So that's what I've heard from
Mm-hmm.
friends from Denmark because
Right.
I used to live there before.
Mm-hmm. Mm-hmm.
So
That I've read that Iceland had mass testing as well, and
and
I think
I think in Scandinavia,
as
Iceland,
well.
Denmark,
Mm-hmm.
Sweden, yes,
Mm-hmm.
in that
Also in
region.
Sweden. Mm-hmm. The results from Iceland is that it's more than half. It's more than half of the number of people who got the test or took the test. They were asymptomatic. So
And they tested positive.
yes. So everyone is
Okay.
studying everyone's data, everyone's results, how
Mm-hmm.
everyone is also dealing with it, how their own governments are dealing with it. For example, Korea, South Korea, they were
Mm-hmm.
initially lauded because they also had the mass testing. You know the drive-through, Tony. You have the drive-through, right? Also in
Yes, I
Australia.
saw that. I saw
Yeah,
that.
it says it's done in 10 minutes.
Yes.
I mean, it's done
We
the
have the
collection
drive.
of the
We have.
swabs and all, but you get the results. I
Uh,
think after it's not a day anymore because the usual is that, but it's 1 hour, 2 hours that you wait for the results. But right now, I think that was just a few hours ago when I watched the news. They were saying
not
that
not here in the United
oh, you don't
States.
have
I
that.
mean, for the result, we do have the drive-through testing,
Mm-hmm.
but as far as the result is concerned, I think you have to wait for at least 24 to
24
48
hours.
hours,
Okay.
Mm-hmm.
Mm-hmm.
which is compared to Manila. You have this test, which was invented by the scientists from UP.
UP, yes.
Siyempre, yes. Wherein you can
Yeah.
get the result.
Oh,
You
incidentally,
can get the
so
result
Brian is also from
in
UP.
two
You're from
hours.
UP.
Yeah.
Ah.
Yeah.
So there
Okay.
is no other university, right? So
Yeah.
According to Senator Miriam Defensor Santiago. So yeah. Anyway, moving on. Also getting that the same PCR. I know it's called a PCR test kit. Is that what you're using there? Did you get
where?
that in
No,
in
I wouldn't know
California?
because I'm not. I wouldn't know because I'm not. I don't
It's
have
not even a
any
PUI.
symptoms. Yes.
Yes, yes.
Uh-huh.
Mm-hmm,
So
mm-hmm.
I would know if um, they can determine that.
How do you do it again? So there's a website. So anyone can just go
Yeah.
to the
You
website
go
and then
online.
just answer a test like,
You go
okay,
online.
have you been
Answer
to
the test.
Italy? Yes, no. Is it like that?
Yeah.
Okay.
Uh-huh.
Mm-hmm.
Mm-hmm.
And then, for example,
We
when the
all
The
answers are
we
usual
yes,
question is,
ah, we also have that
then they will
website
determine.
here.
right,
Yes,
right.
We also have
then
that
they will
website here.
determine.
Yes.
Mm-hmm.
Yeah. So I think it's because of the lack of this
Communication.
testing kits
Right. Of course. Yes.
that made them decide to, determine first and prioritize who needs testing.
Yes, right.
Because as we
Yes.
all know, we don't have enough testing kits.
Correct.
I
Yes,
know that
that's a fact.
California, yeah, it's a fact. I know that California right now is, I'm not sure if it has been rolled out, but they apparently they've come up with this testing kit wherein you can get the result or have the result in 40 minutes.
Hmm.
So I don't know if that has been
I
rolled
am
out.
curious now because you're saying there's a site and then there's a 40-minute test. Brian was saying that in it's Scandinavia, Denmark, so it's getting sent. The test kits get sent
Yes.
to the citizens to your home, and then you submit like you send it back with your specimen. Uh, and then
And what
earlier,
is the population of Scandinavia?
so
Yeah, well, that would be easier for the Scandinavian countries
Uh-huh.
because they have a very small population.
right,
Oh, that's why.
and
Yeah.
Denmark,
Testing is, yeah,
Mm-hmm.
test like Denmark has only 5 million people
right, and then
all over the
Sweden,
country.
right, right,
That's why testing is much more manageable in those countries. I
right.
think the website that Tony was telling a while ago, which is also same here in France, it's more of a self-assessment
Okay. Mm-hmm.
that I mean, so that the government doesn't have to,
Yeah.
test you if based on
If
that.
you're not,
Right.
Yes,
yeah.
if you're
Uh-huh.
not. So I think that website is also helpful.
I'm curious
Mm-hmm.
about that, how they're doing the test, because in New York, so I don't know if you guys have watched it. So there's just I think CNN, they were showing like an inside view of what's happening there. They've
Mhm.
transformed some of the rooms areas into like isolation rooms, or this is specifically just for the PUIs. You see plastic like cover in
Yes.
certain areas, and then of course you see that the nurses, the doctors, everywhere you see that they are talking about the testing as well. It is a problem for them because one doctor was saying, the one who is conducting the test, he said it's very easy to make a mistake. He was talking about just like it goes up by 1 millimeter when you something about, I don't know I don't know what that is, but he said you can easily make a mistake. And then I'm thinking, what about the PCR kit that was done by by the Philippine team.
Are you are you are you talking about the testing kits that were
Yes, or the test, the
sent,
actual test,
or that
The actual test.
because
That China sent? Because
yeah, well,
China did send testing kits. I read that it's faulty.
oh,
Yes,
okay.
it's only
So, well,
30% efficient, and the test
yeah.
kits must be over 90% efficient. But the one sent by China is only 30%, like the one in Spain. That's
Oh,
why Spain and Portugal, that's why they're sending it back to China.
okay,
Yes,
wow.
So,
that's why. I don't mean to be, I don't mean to be a racist or anything. I don't want to sound
mhm.
racist, but
Just
we all
factual.
know, if it's made in China,
Just
we're
factual,
not
Tony.
very. So,
Yes.
but
Okay.
China, please don't get mad at me, all right? I mean, let's face it, we're still having this war trade with China,
Yes, and
U.S. and China.
we're talking about
They're one of the
people's
biggest
lives.
All right,
traders.
or
Yeah,
I
that's
think you're
true.
more, what you wanted to say was that the quality was not really, at par, especially because we're dealing with lives.
Yes.
So you said it's 30%, or maybe that's why the people are 30% accurate. Was
Yes,
that right?
that's why they said
30%.
it's not. I mean those test kits sent by China,
Mm-hmm.
they discovered that the efficacy is only 30%. But for a test kit to have a much more dependable result, it has to achieve at least or more than 90% efficacy.
Correct, correct.
So
Yeah.
that's
Earlier, I was just watching. I'm not sure if it was DOH or so many people, being interviewed right now as a lot of experts. But here in the Philippines, so we have the PCR test kit, and then the other one is the rapid test. Right
mhm.
now, they're expediting, they're fast tracking the approval of these test kits. But the problem, aside from not having enough test kits, or I think having just a small number of test kits, apart from that, number one, they said that a doctor needs to be present when the test is being done or conducted. So I'm now
Okay.
thinking about the Denmark situation where it just gets said, test yourself and then just give me back
I
the
don't know how
results.
I don't know how they do. I don't know how they do it, but yeah, I've heard from friends in Denmark that's what they do.
Right, right,
They send
okay.
the test kits,
Then
or
you just
maybe
to submit.
is it the yes? I don't know what kind of test kit is that. Is it like a no? I mean the a portable test kit
Right,
that
because it's yeah,
like when when you try to get your sugar.
right.
Sometimes we do it ourselves. So I don't know.
Because it's something that after they got it from China, I think around January, because of course it came from Wuhan, so that's what
Uh-huh,
they used to based it on, what all the other countries
uh-huh.
based it on. So they developed their own. So the Philippines, of course, developed its own. You guys developed its own. Denmark
Yeah,
most probably
yes.
then developed its own. South Korea, so they had their own. We still don't have a cure, right? We still don't have a vaccine. But of course, I know the
Yes.
U.S. is definitely testing that. But I just heard on the news that the human testing starts in September. This is gonna go on.
Someone from I can't remember which state, but someone has been already tested or injected with the
Antibodies.
Vaccine
yeah, with
with
the
the antidote.
vaccine.
Ooh.
Uh-huh.
Okay.
So well, I haven't heard of any uh, um, news on how did it go. I mean, how was the result? So let's cross our fingers and hope that
Hmm.
this vaccine is really going to work. There is
But
no, well, we all know there is no immunity
mhm.
from this virus
Right now.
because COVID-19, no one on earth, because this virus was just discovered in 2019, just
19,
last year.
correct, yeah.
Yeah,
Yeah,
late last year.
late last
But
year. So
what's your
it's not
take
like
about?
cholera or malaria or where we already have
Mhm,
the cure, the vaccine for that, even
mhm,
HIV.
mhm.
Yes, Brian.
Yeah. So, but I'd like to ask, what's your take about this? Oops, my iPad fell again. What's your
Yeah, what's your take on?
That's what
everything
happens when you're
happens
live.
yeah, everything happens when you're live, yes, but the show must go on.
Right, correct.
What's your take about this medications with off-label like the hydroxychloroquine, if you've heard
Hydroxychloroquine,
those
yeah, right,
news,
right.
and
Um,
the Z-Pack,
that's actually
that's
the top recommended medicine or cure or treatment, right? But it's not
yeah, off-label, it's not
for me.
the what do you call
For me, I
Are
would
we
really
talking?
listen
Are
to
we talking
experts.
about?
Yeah,
yes, me
Are we
too.
talking? Are we talking about this?
the treatment, the medicine.
That Trump said is already a
Yes,
cure.
yes,
Oh
yes,
my
yes.
God.
Did he
Yes,
actually?
yes.
Did he? Has he?
Anything. Yeah,
Yes,
he
he
did.
did.
He did. He was the
He
Okay.
did,
one
and
who, he
yes.
announced
That's
it.
why there's an
That's why
American who
you don't believe anything that comes out from
Okay.
this, from this president's mouth.
And we
Okay.
respect we respect what okay, your
And then
stand,
there is
yes.
another president from Belarus. I can't remember his name, who said that the cure, he's mocking this coronavirus and he's saying that um, vodka can cure this.
No, there's actually
Okay,
been
so we have
um
another
that's not
idiot.
true.
I think even in the
We have
Yes.
another
Philippines, right,
idiot
where
here.
we're now prohibiting that because it doesn't. The Department of Health just issued that no, we are not, we're
Yes.
not, because
Mhm.
it makes your immune
I,
system weak. It makes you
yeah,
And
weaker.
also
vodka. I mean, my God. Maniwala pa siguro ako kung ano, no, yung Marca Demonyo, yung Ginebra San Miguel.
Oh, okay.
Baka pa.
I don't know
Okay,
what that
pero
is.
kung vodka, I don't know.
Yes,
No,
Brian.
because the
Sa
scientific
Pinas, we call it Marca Demonyo.
Are you
no, I
familiar with
guess
that,
the
Brian?
scientific
With Marca
the
Demonyo?
Yeah, di ba,
scientific
Brian?
explanation I think the scientific explanation of that is because the strongest alcoholic drink like vodka is only 40%. And to kill the
Mm,
coronavirus, you have to at least 70%. That's why
mm.
they recommend the isopropyl alcohol is 70%, more than
Right.
the ethanol.
Right.
So that vodka is just a myth. It's not,
Right.
you know.
Did you see that? Though? Of course, it's here in the
But
Philippines.
I initially believed. I actually
70%, right?
initially believed.
Yeah,
I
yeah.
initially believed that vodka can actually cure, treat corona at first.
But of course, we got that
Really?
information from the experts. No, it does not. So please don't get
Yes,
drunk,
Does
people.
not.
Don't get drunk. So, but I saw that there's a, I think it's just on Facebook. A rider, right? He was stopped at the checkpoint, and the temperature, of course, was high. And then he explained, "No, because I'm a little drunk because I don't know what he drank, but that's the same reason. He thought that that's going to protect him. So information, facts matter right now, and I think that's what we all need to know. How do we deal with this virus? This is not the first time that we handled such a pandemic. We had, I think, 1918, if I'm not mistaken. We had the Spanish
Spanish
plague,
flu.
the Spanish flu. Then we also had the
Yes.
bubonic. That's how I pronounce it, right? The
The
bubonic.
bubonic
That's
plague?
I think
Yes.
Yes.
1300s. That's millions, like
Yes.
one third of the
That's
population
the
200
wiped
million,
out.
I think. 200
Yeah.
million people.
that's the Black Death.
Yes,
Yeah,
that's
the
a
Black
Yes.
black
Death.
death,
Yes.
The Black
and they
Death.
even
And
had
then, of
to.
course, we have AIDS,
Right.
right?
Yes.
In
Yes. Yes.
1980s,
And
yes.
yes, in 1980, and then we have cholera.
Cholera in the 90s, yes.
Right. Right.
Yeah.
So when you look at that, we've been through a lot. So we not a lot. I mean, but this is something that we should have learned from, right? And I'm sure we have, with the things that we are observing right now. We see the effects of that, on how we are better dealing with it or addressing it. Despite that, what do you think are the things that we should still improve on, or possibly something that you glaringly don't agree with? Tony,
What do you mean overall? You mean
anything that you
overall
observe, well, what's being
improvements
done there in the
in
States, around the world?
one is we have to listen to science. Okay,
I agree.
and then yeah.
Yes,
Now,
yes.
in terms of how our governments is handling pandemic situation, I would say that stop partisan politics, stop bureaucracy, because
Correct. I agree.
you need to get the relief and the help down to the people immediately. And when you have bureaucracy, you know what happens
Exactly.
when you
Yes.
have
A
bureaucracy.
lot of the
So, and that
healthcare
is
workers
why,
are complaining about that here as well.
yes,
Red
and
tape.
that is why people are, screaming, angry, frustrated, complaining, criticizing. I wouldn't be surprised if they would, the moment people are hungry and they're not getting the services, it's going to be chaotic. There's even
Yes.
going to be violence. I wouldn't be surprised. Once people are hungry, they will sort the violence, stealing,
In the
you
Philippines,
know.
we are just, they said this is just the first wave. So the count is always 2 weeks, right? So we are just on the second. I mean, we're just done with the second week, and then we have another 2 weeks. But we're looking at the count; it just keeps rising. We're just getting the test kits distributed, so the number will go up. But then we also don't know the people who are just asymptomatic and have it and are actually just spreading the virus. My problem is what happens next. I definitely would want. I know they're expediting it, but if they can really expedite it further, the distribution of the kits, creation of other ways to test it because it's costly. I think that the Philippine government, I can see it. We don't have enough to test a lot. And that's why even the doctors are dying here. If you compare the statistics, the number of doctors that die here in the Philippines as compared to the States, so there's like thousands. One doctor is to thousands of people.
The
Whereas
ratio, you
here,
mean?
the ratio, yeah, I'm sorry, the ratio.
Yes.
But here in the Philippines, it's higher. I mean, it's less. Like one doctor is just hundreds,
Is
a
it?
few hundreds. Yeah. So those are doctors, and we need the doctors right now. So when they're the ones getting sick,
That's
that means we're
yeah.
also
If
getting
I
more
may say
people. We're
this,
having to get, yeah, go ahead.
yeah. If I may say this, that is why you don't cut the budget for
Health.
healthcare
Yes.
services.
Right.
Right now, that is the number one, or I can say the biggest problem here in the United States.
Oh, yeah.
The healthcare system.
And I
Our
think in the
healthcare
Philippines
system
also.
Yes.
is not as good as
Yeah.
in Canada or Australia. So
How about
we
France?
are
Yeah, sorry, go ahead, Tony.
France.
No, no, in France, the
Healthcare.
government invests in healthcare. We have a very,
Yeah.
very good healthcare system here in France. Everybody has, their own card, but it's not
Uh-huh.
similar to the one to the PhilHealth in the Philippines,
Uh-huh.
Uh-huh.
because that
Do
one,
explain.
that
Expound.
that
Is
one in
it
the in
is it
yes,
universal? Is it universal
yes, it
healthcare
is in
in
France.
France?
Yes, the
Wow.
moment
So
you get the moment your mom brought you to this world. I mean, at birth you
That's it.
already
Yeah.
have your own health card,
see,
and
that
the
is not how it is here.
and the coverage is almost complete. I mean,
Complete.
yes, almost.
Is there a specific guideline
So
now as regards coronavirus? When it comes to your healthcare benefits, has your government, do
yes,
you have that? Like the coverage.
I it is covered by the Carte Vital. We call it Carte Vital here, the health card. So I just don't know
Yeah.
if the actual testing is
Is
covered.
yeah.
That's not yes, but like the medicines, for example, if you get sick here, you just have to go to the pharmacy and present the prescription, and they will and present the card, the health card, and they will just dispense the medicines you need for free. You don't
That's
have to
just
pay.
fantastic. Wow. Okay.
Yes,
Right.
yes.
It,
They
well, uh-huh.
that's what I want to tell, especially Philippines, that what should have been improved is really
The
investing
healthcare.
more
Yeah.
on the
In
healthcare,
healthcare
like
services,
Healthcare.
what
yeah,
Tony was saying a while ago.
yeah.
That's also a big issue there.
That
Even
is the
before the
problem. That is the
pandemic,
biggest
that's
problem
been
in
yeah, that's been a big issue there in the States. I mean, it's on the news as well, right?
Yes, yes. I mean, you can go to a hospital. Okay, let's say you get ill, go to the hospital.
Mm.
They will not, they will not send you away because it's against the law, but expect that you will be receiving bill
Right.
Okay,
thousands.
Okay. So
I
You
see.
will be, so that is the problem.
they don't
And
refuse, but that you get
no, they won't.
you
They
pay for
can't.
it,
They can't because it's
so
Hmm.
it's
against the
not
law.
covered. Okay.
Yes.
But definitely they will charge you. You will be
Hmm.
getting, bills
What do you guys
just
see
to,
there in your immediate vicinity? Like here, I'm in Taguig.
Not
I mean, how are they like? Do you see people like
here.
cleaning the streets,
I know. The last time I went out was yesterday.
disinfecting?
I no no I saw nothing and no one except the empty streets.
Okay. Okay.
yeah,
But
same here.
yeah.
Yes, Tony. How about there?
Same here. Same here. Same here. Um, uh, uh, I saw, wait, I think it's in Taguig, right? In
Right. Right.
your
What about yeah?
area? In Taguig and in Quezon City. They are sanitizing, disinfecting
Yes. Yeah.
the road, the
Hmm.
street.
Right.
So
We're also
I don't
giving.
know if they're doing that here because I haven't been going out of the house.
But I've seen that in some other Asian countries. I'm sure you guys are in London. I think it's in London.
Mm-hmm.
I think they're also doing the same thing. It's just like trucks really disinfecting the street.
Disinfecting the street.
They
Right.
better. They
Because
better.
Prince
Yes,
You
Charles
yes.
gotta
already
keep
has it, and Boris Johnson
you gotta
already
Prince
has
Charles.
it.
you gotta
Yeah.
keep the queen alive.
Oh, Prince Charles is in Scotland. Okay. Anyway, so yeah, but he's in quarantine. So moving back, we are, as you all know, the Philippines is a third world country. You guys are there, and definitely it's different. There are a lot of similarities. I'm observing. I'm
Mm-hmm.
realizing there are a lot of similarities, a lot of difficulties, challenges being experienced
Yeah,
by
but
all of us.
The Philippines is not doing bad.
Oh, okay. Mm-hmm.
Despite a lot of complaining and anger and frustration uh, from
The frustration
uh,
is understandable.
from the
Yep.
people.
Mm-hmm.
hmm But if we're going to look at the other countries, how they are doing, like I was very happy with UP coming up with this testing kit.
Yeah. Mm-hmm.
Yeah, and
Yes, of
the
course.
United
Yes.
States did not even come up with that testing kit right
Mm-hmm.
away,
But you guys have
but
been testing
UP
it.
did.
You guys have been testing it. It's just not approved yet in the states, and I'm not sure
Well, I
which
don't
state
know.
they're. Yeah, that's why. That's also the
The
problem.
one the testing kit from UP is already approved.
It's been
Yes,
rolled out.
it's
Yeah, it's been
yeah.
rolled out.
Ah,
Finally,
okay.
yeah.
Ah,
Hmm.
nice. Good news. Yes.
Yeah,
Yeah.
that's what I know.
Uh-huh.
That's what I know as well. And
Mm-hmm.
but
And
still, it's
the Philippines
costly.
is one of
I
when
appreciate the
did you
quarantine.
yeah.
Yes.
When did they start
The
the
enhanced.
quarantine
The
there?
enhanced,
Uh-huh.
of course, it was before that, but the enhanced quarantine was March 16. So you guys here in France, it was March 17, almost the same day.
March 17.
Right,
Yes.
yeah. So we did it almost at the same day. And I know it was all around the same time, Tony, when Donald Trump, I'm sorry, US President Donald Trump also put restrictions in terms of travel. That's when he announced that. And
Yeah.
then after 1, 2 days, that's also when he, I think, announced a quarantine, but not in the whole of the United States of America. And as I said, New York
Can I
didn't.
just say this?
Yeah.
Can I just say this? I would choose Duterte over Trump any
Over
time of the
Trump.
day.
Okay.
Okay.
That's a strong
Okay.
statement. A lot
I
of
mean, if
people will have a very strong.
no. If there are only two presidents left, okay, let's just say if there are only two presidents left, and you have to choose between Trump and Duterte, I
How
would
about
choose
you choosing
Digong.
between President Duterte and
Macron.
yeah?
Macron,
Why? I would need to ask why.
because
You need to be objective, Tony. Okay.
because he's hot.
There you go. That's the problem, Brian. Okay. You see, the problem here is we're not gonna get something
but
really,
but
Mhm.
Macron's type is someone who's very old.
Yeah, I'm younger, a little younger than the wife. So
Than the wife. No, but the wife is she's a very nice woman, very
Mm-hmm.
yeah,
refined.
hmm
Mm-hmm.
Yeah,
she's gorgeous.
President Macron is doing really good.
A great job.
Yes, for me,
Mm-hmm.
for me.
Yeah.
Or maybe because the people are very participative also.
It's the same. Yeah, that's
Yes,
right. It's both things. It's not just them.
that is
There's two.
important.
Yeah, it
That is
takes two to tango,
important.
so to
You
speak,
know.
right? So,
Yes,
um,
yes.
Yes.
I've been
Yeah.
hearing a lot of things about people saying don't complain, and then people saying why can't we complain? It's when we complain that things get improved, and then
Criticizing,
people say let's
right?
just contribute. What
Criticizing.
did you contribute? Hashtag there are a lot of things that it's just a back and forth of arguments, and then sometimes you have to
Yes.
scroll down. Okay, so what's happening? What's happening? So what's the current count? Is there a cure? So you look for it. You have to search for it. It's exhausting. You having to filter just to find out. Okay, what do I really? What is essential for me to know? Okay, yeah, I respect your. opinion on this. I just want to know how we're dealing with it right now, or how other countries are dealing with it. And that's also how we're going to learn, and also how I'm going
It's
to learn that
important to
are we
me.
doing better than others? Are things improving, or is
I don't know.
yeah.
To me, it's important to have. I mean, criticizing is different from critical thinking.
Yes.
You know, so we need to be critical, yes, but know the difference between critical thinking and just criticizing.
Correct.
Criticizing.
Yes, because if you're spreading and sharing and posting, criticizing, just criticizing, it's so negative. What what does it how does that help people?
Yes.
You're just spreading
Mm-hmm.
criticism. If you are going to be critical and
Critical.
if you're going to criticize, make sure that you have some
Something to
action
offer.
plan. Exactly,
But
something to
Yes.
offer,
the
right?
counter
Something to
argument to
offer.
that, I mean, I'm not saying I'm that person, but the counter argument that I can think of to that is, if I am saying this, I am speaking out because this is number one, this is my right, and then number two, how can things get improved if I don't say it? But I think,
Use your right. Use your right intelligently. Okay, so you want to criticize. You have a lot of issues with your government. So you keep criticizing because it's easier with all this, social media access right now. In a snap of your finger, you can post whatever and share it. Multiply those people who love to criticize every minute of their day when they go online. Why don't you use that criticism or critical thinking down to the ballot box? Go there
right.
and vote. Don't
Vote.
boo,
Yeah.
vote.
Right, right.
Stop all
Mm-hmm.
the, ngak 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 dyan, daldal ka ng daldal
Yeah,
dyan. Bumoto ka.
voting is a
And if
huge
you're not even,
responsibility. Yeah, that's right.
if you're not
And
even a voter,
It's
if you're
it's a
not even a
right. It's a
voter,
responsibility.
yes, that's
yeah,
true.
and
And
you know what
I
I hate
agree.
about
Yeah.
those people
Are you talking
who
about
don't,
Filipinos?
I mean, they don't even vote. No, 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 no,
Okay,
no.
everyone.
Not
Okay.
not just Filipinos.
Right.
They love to do all the talking, and then you find out they didn't even vote.
Right.
So what the are you talking about?
Okay.
If you don't
What's the point?
vote,
What's your
right?
yes.
Exactly. If you don't vote, shut the up.
Okay.
Yes.
Right.
Stop
Okay.
But
posting.
I'd
Stop
like to
posting your
make it a
criticisms.
hashtag. Don't boo, just vote. Di ba?
Right.
Just
Hashtag don't
vote.
boo,
Don't boo,
just
Yeah.
vote.
just
Yes.
vote. That's right.
Make sure that make
Yeah.
sure that you're voting for the leaders that will create or serve a government that is for the people, by the people, a government of the people, by the people, for the people.
Right.
You have to think. You don't just, uh,
And
you don't just open your mouth, click, post, share,
right.
Yes.
And
and
when
then
do
you
you think
don't
is the
even
perfect
vote.
time to do
You're
that,
not even a voter.
When do you think is the perfect time to determine who these great leaders are? Now. This is the time for you to determine, who
Yes.
stood out.
Yeah.
I mean, I'm sure you've seen the
Mm-hmm.
hashtag mayor,
Who kept,
the
hashtag
mayors,
mayor,
Mayor.
the mayor of choice of a lot of
this is
Filipinos right now.
this is the
And
best
Yes.
time right now to
to list it
this is
down.
the best time right now to think if you are still going to vote for Lito Lapid.
Okay, that's very specific. Okay.
Oh.
So, all right. But okay, I understand. So, yeah,
No, I mean,
go
What?
ahead, Brian.
you're talking about being critical and just
Oh,
simply
hey.
criticizing.
Yeah.
Well, for me, I think if you want to say something about or against the leadership, you become critical when you think of what should have been improved, but in a greater good. I mean, for everybody. But once it becomes, if your objective is to just align it to your own personal perspective, then that's the time
Yeah.
it becomes just simply criticizing.
Correct.
I
Or
mean,
I think it becomes personal. Like you have this intense
yes,
hatred towards a specific politician. I'm very happy to hear that it's being dealt with really well there in France. A lot of things that we can improve on. Look at the brighter side of things. What do you think have been the positive outcomes or results? What have you observed are happening around you in the Philippines, as Filipinos, there wherever you are? And what do you think can be a positive outcome of this? Anyone?
well, I think
Brian first.
people, I think people become more hygienic.
Right.
Yes.
Like me, I honestly, I confess I don't really practice much hand washing. Well, I do wash my
Mm-hmm.
hands, but not, the moment I step into my house,
Yeah.
I
Right,
don't.
yeah.
It's not my first instinct to go straight to the
And
sink
wash your hands, right?
and wash my
Mm-hmm.
hands. But now people are becoming more conscious about that.
That's right.
So
That's
I
good.
think that's what positive impact.
Mm-hmm, mm-hmm.
And then what else? Well, we've seen a lot of photos about our environment. The ozone layer has been healing since
Yes.
the
Mm-hmm.
this.
Yes.
So I think
Because everybody
that's
is at work. I mean,
yes.
At
everybody is working
home.
at home.
Mm-hmm,
So,
mm-hmm, mm-hmm.
yeah.
I think those are the very evident positive effects of this
True.
crisis.
Mm-hmm.
Yes.
Yeah. What about you, Tony?
Yeah. Same. I agree with Brian. Um, uh, Earlier, I was saying that it has made me paranoid, and I've come to
But you already are like that.
realize or
Brian, for your
learn
information,
that.
she loves disinfecting, her
Hello.
vicinity. So she is that. So I don't think that was a problem now, but you're more paranoid. What was that, Tony?
Yeah, I became more paranoid, and I've come to learn and realize that paranoia is not so bad. Paranoia, it has its uh, good side to it. Um, I became
Actually,
more
I don't.
For
suspicious.
I
Yeah,
yourself?
Yeah,
go
I
ahead,
think
Leo.
it's not really paranoia. It's more of being resilient and more prudent.
Right.
I
Mm,
think
That's
that's
true. Yeah, yeah, that's a correct term. But what I
No, what I mean is paranoia. It somehow has its good effect because especially now that you don't even know if the other person sitting next to you or the person in front of you already has a virus. So if you're paranoid about that, it teaches you
it
to be
helps.
more careful and more
Right.
conscious,
Yeah.
of your
This
health
Mhm.
this is the
and
time that
conscious about
paranoia.
other people,
Yeah.
Brian. So there, and what else? Yeah,
For,
I totally agree with what Brian said.
for me, what I think is a positive outcome is there is a we have always appreciated our health workers, our doctors, our nurses, our medical
Yes,
practitioners,
Yes.
but now more than ever, this is I
more
think
than
that
ever.
we are at the peak of that appreciation. We
Mhm.
are lauding them. We are just we give our heartfelt gratitude, our praises. Of course, that's not enough, but this is the time when the spotlight is on them, and we now
On
really
them.
look at their problems, how difficult life is, really, that they're definitely putting their lives at risk. It's like a
Advocacy. As
yes,
an
I think it's more
advocacy.
of that now because it's sacrifice. You have to.
And
You're doing it for the service of everyone, for lives to be preserved. Yes, Tony.
we need to remember, keep in mind, in times like this, war, war with another country or
Mm-hmm.
war with with a pandemic like this, they really are the military, the police, our health workers. They are the frontliners. So when the when something like this happens, it's always them. It's always them who are helping us survive.
Right, right. And I think it's also now that we see a lot of good Samaritans, right? We see the
Yes.
people helping out, because out of the goodness of their own hearts, they just see that because everyone needs help. The governments, different governments, the hospitals, they, especially when there's a surge of cases, they need beds, they need ventilators, they need respirators, they need the PPEs, and the supply is just not enough. So everyone who can
And if
contribute, and we say thank you to those who have contributed, to those who have helped, to those who are able to and did, and those who are not well off, not wealthy, but still contributed in
Yes.
their own little ways.
yeah,
Yeah, we see that
uh-huh.
now. Yeah, go ahead, go ahead.
Yeah, that's one thing I want to add. Positive outcome from all of this. I would add, um, now people are doing it more, contributing, helping out. People have this, how should I say it? They're doing it for the good of humanity, right?
Yes.
People have come together. So that's one positive.
And then definitely
And
because there are a lot of people who are getting well or don't even need treatment.
yes.
That's 85%. I think 85% of those who are infected by the virus don't really have to go to the hospital. Just need to go to stay at home. We will develop a vaccine, and we will be better prepared for this when it comes again in the future. And
Yes.
hopefully we would now also improve whatever healthcare systems we have in place, whatever pandemic preparedness guidelines we have, especially in the Philippines.
And
um,
protocols. Yes.
Correct. And it has to be comprehensive. Now we see it. You don't just tell us the big picture. You don't just tell us, yeah. And I'm speaking for what's happening in the Philippines. Like you don't tell us
Mm-hmm.
like 10 guidelines. We need like 20 guidelines under each guideline. It has to be very specific, and
Mm-hmm.
like scenarios. What if this is not the case? What happens then? So, there are so many things. Like, for example, if I may just share, earlier I was listening to a doctor who was complaining about the mayor. And he's from a province. He's complaining about the mayor closing down the hospital because he had to treat a coronavirus patient. And that patient is also a doctor. But that doctor is from Manila. So there's supposedly an agreement that,
Mm-hmm.
you're not supposed to treat someone from outside our province. And, so why? because
What?
because that's going to be like the
Excuse me?
first
You're not
case
supposed.
to treat, because
Oh,
it's about
okay.
handling, how you're going to handle and manage that patient. Because
A
once
patient.
once you have
Okay.
that inside our, let's say, our city, then of course the possibility of it spreading is already there. So how are we going to manage that?
Mm-hmm.
So we see that problem there, the communication problem, the communication gap. Because
Mm-hmm.
of course the doctor will say, it's my Hippocratic oath, I am, of course I cannot say no to a patient, especially
Mm-hmm.
since apparently this doctor was already refused here in Metro Manila. So that's what's happening right now.
Yes.
Just so you know, the number of establishments, of hospitals that can take you in, it's just really small. So they are now going out of Metro Manila. And then there's also this, like, I'm going to refuse you because you're going to spread the virus here. But then, no, that's not
Yes.
what happened. He was treated there, which is good. But then he had to be swapped, sent back.
Who
Because
is this doctor?
oh, I didn't get the no. There was a name, but I'm not gonna mention that anymore. But it's from Quezon City,
Yeah, yeah. But what I'm saying, oh, from
Mm-hmm.
Quezon City. So he
right?
refused.
No,
He's
he
saying
wasn't
that you're not
refused. But the
supposed to
the
be
problem
treated
was the
here.
mayor
He
closed it
wasn't.
down. The mayor closed down the hospital, but it's now operating again. I think it's just for a few hours because supposedly that agreement. I understand that the doctor's perspective. Also understand the mayor's perspective, because the mayor's also thinking about his constituents, his the people in his area, in his province. How are we going to deal with that
Mm-hmm.
in case it spreads? What we already have a big problem when it comes to the facilities, tools, test kits. We don't have a cure yet. And then once we have one, it can multiply fast. So I get that. But then what? How would you deal with that when the doctors or
but
when patients are
doctors,
getting refused? So of course, where will they go? They would want to be treated. So they will go to the other to the provinces, right? So how are we going to deal with that? I mean, these are the guidelines, the details that matter because we're dealing with lives, just like what Bryan said. So I hope the next time it happens, and I hope not, but
Mm-hmm.
it's always possible. There's always going to be like a different strain of a virus that can come out from corona. It can be called a different thing, coronavirus or COVID. I don't know, 2000 whatever, but hopefully not.
speaking of
Lord, please don't. Yeah.
speaking of this, pandemic or virus, I was just wondering, I when I was reading all the outbreaks that we have gone through,
Yeah.
I observed that a lot of you know a lot of these viruses originated from Asia. Why is that? It originated from Asia. A cholera originated from
Yeah, that's
India,
cholera,
and
but
then it spread.
1300s,
You
the
know,
bubonic plague
um, this
wasn't. It
what do you
spread
call
in
this?
Europe.
This influenza.
Mm-hmm.
Originated or started in Hong
Usually
Kong,
in or
in Asia. Yes,
China.
I think you're
Asian
also
countries. So
talking
why
about
is that?
SARS, right? But
Mm-hmm.
uh,
Mm-hmm.
I think what is more overwhelming is how we're going to avoid that. What are the things that caused that led to it, and why did it happen? I think that's what we need to focus on. So why did it happen again? Why did it come from there again? And how we're going to avoid that. But then again, viruses, bacteria, it's everywhere. It can happen anytime. So what we can do, I think, aside from that,
Does it
helping it
does it have to
stop
do
that.
with hygiene?
Yeah, it can
Hygiene.
be,
Yeah.
because it came from animals,
Listen to
right?
science.
Right.
Can we keep social distance for good? I like
Oh,
it. I like that we
okay.
have social distance.
Mm-hmm.
Like,
Mm-hmm.
yeah.
But on a personal note, I mean all this home quarantine fiasco, while it has cost us our social lives. On the other hand, it we've been given that opportunity to for self-realization.
Correct. Yeah.
We to realign our goals. What have we done? Not just for our own selves, but for our communities. I mean,
Mm-hmm. Mm-hmm.
it's we've given an ample time to think of whatever we can do for
Mm-hmm.
the greater good, not just for
Right.
our
Yeah, for
own.
the greater good of
Mm-hmm.
humanity. Yeah, because
So
at the
that's
yeah.
how that's the positive side of this home.
Yes.
While it's very difficult staying at home. I mean, our social
Mm-hmm.
lives have been compromised so much, but the positive effect of that, I think, is that self-realization. We've been given the time to actually realign our goals.
Mm-hmm. And I think
Yeah.
for
Yeah, I
me,
agree.
it's
That's
realizing other things, like on a personal level,
yes.
what is happening to your career, hobbies, talents that you could
Relation.
have
You're
honed. Yeah.
talking about relationships,
Yeah.
relationship with our family.
That's
We've
right. That's
we've
right. Mm-hmm.
been separated by this by
That's
technology,
right.
the social media, and now we're together physically because of
Mm-hmm.
this home quarantine.
Mm-hmm. Mm-hmm.
So that's how we should look at things. Always the brighter
And
side.
also finding out who cares, right? You also find out, okay,
Yeah,
Yes,
well, I
who
wanted
yes,
to
took the
say,
yes.
time to,
That's
hey,
yeah,
say, hey, hi, how
yeah,
you doing, you alive?
yeah, because at the end of the day, the question would be, how did we care for each other?
Mm-hmm. That's
You
right.
know,
yes.
I
I
like that.
think
Mm-hmm.
caring, yeah, how did we care for each other?
Mm-hmm.
How did we survive this, pandemic?
Mm-hmm. And I think my objective for this podcast is to document this. I want to, look back, look back in time and listen to us again talk about this. How did I feel back then? How was it dealt
Mhm.
with back then? How was it in the US? And then I would, we will come to realize that, yeah, after that discussion, this happened. Or, after that discussion, these are the changes that happened after that. And, oh, now we have this handling it. Or we can, this is my goal, to document the discourse. What's the general message of the people? There so much hatred at that time? I think there's more. During the first 2 weeks here in the Philippines, there's a lot of hatred. I think even now, yeah, even now, there's a lot of hatred. There's a lot of,
Yeah.
complaints. I am on that side where let's focus on what to do now. Let's focus on how to solve this, or let's focus on how I can help, or probably just even, help disseminate information. Yep. Go ahead, Tony.
Yeah. Let's focus on what we can do now, you know, this moment. Let's try to set aside politics.
Yeah.
We always have that option, for those leaders who screwed us up. We can
Right.
always get back at them. Election time. I mean, how many more months from now, and we will have our election this November.
Right.
So I already have a list of. I already know
Who to
who
vote for
I
and
will
who
not
to
vote
not
for.
vote for.
The government's system, it is flawed. You can't
Mhm.
expect it to be perfect or 100%. That's why we need to be very, very careful of who we vote, because these leaders, they are the ones who are going to lead us, lead us to
Yes.
chaos, lead us to disaster,
Or
or
the other way around.
or
Right.
the other way around, right?
Okay.
Yes,
And
right.
dealing with this pandemic, we need to remember. We need to remember that we are responsible for the health and safety of others as well, not just for yourself.
Mhm.
How do you guys, I want to ask
Yeah.
each of you, how do you visualize what's going to happen after 4 months?
After 4 months.
Yeah.
After
What do
four
you think is
months.
going to be, just like, based on whatever information you've read or heard, how do you think the world, or what do you think the world is going to look like? Is
Well,
it going to
definitely.
improve or not? At the
I
rate
think
things are
so. I
going?
think so. I'm positive because
Yes.
this will definitely give us a lot of lessons, lessons learned. So I'm positive. I know it will have, we can do a lot of things for better after this.
I'm thinking that there's going to be probably the 90% or more likelihood of really curing the disease, the virus. That's one. I'm trying to visualize how it's going to look in the society after this, after coming out from
After,
quarantine. Are we gonna be excited to go out? Like, hey, yeah, freedom again. Hey, hello, people.
no,
Hey, I can touch your hand now.
It will
Okay.
be
it's too
it will be
early.
normal,
It's
I
too
think.
early.
Right now, right? I'm thinking,
I
no, I
mean,
don't think so. I don't think people will be, I'm not gonna touch. Where's my alcohol? Where's my
Everybody will be back
sanitizer?
to do
Yes.
uh-huh.
everybody will be back to their, their normal routine.
Yeah, yeah.
I mean,
Back to work.
back to work. I think the positive effect is more on the leadership, how they, how they, I mean, their priorities in terms of using the people's money. And what you've
Yes.
said, Tony, a while ago,
Uh-huh.
the investing more on the healthcare. I
Right.
think
Yes.
the
Yeah. Stop cutting the budget.
yes, I think the government of all societies will, realign their budgets and
Mm-hmm.
prioritize the health of their constituents. I think that's what I'm visualizing.
Right. But I'm
Mm-hmm.
also I don't like to wait for this to happen, but I'm already expecting, because we're already seeing the downfall,
Mhm.
so to speak, of the economy around the world. Of course, this is affecting all businesses. Just like here, where the Philippines, as you know, is a third world country. There are people who still need to go and sell on the streets, so they would have something
Mhm.
to eat for that day. I know recently there are 300,000 workers that don't have work now because of this. A lot of establishments have closed down. So that's one impact. That's one thing that I can foresee. How are we
Mhm.
going to deal with the unemployment rate?
Right now, our government, how our government is dealing with this in terms of, the economy and those people who lost their jobs. Just a couple of days ago, the 2 trillion
Yeah, the stimulus
budget
plan.
relief,
Yeah,
yeah,
that's what it's called, right?
has been,
Stimulus plan.
yeah, has been, it's been passed, and I just, the it will definitely have great impact
Definitely.
in the economy,
Is that 1 trillion?
and two,
Two
two
trillion.
trillion,
Yep.
and I pray that America is not going to
Go through recession.
have another,
Right.
another
But there is something,
recession.
they're like world leaders, right? I'm not sure if it's 20 countries around the world that came together.
G20.
Yeah, yeah, the
You know
G20,
the G20.
they have they're also coming up with but it's billion, like $1 billion
Mhm.
funding to help aid, or to aid all countries, all those countries suffering
Yeah,
from
yeah.
the coronavirus.
The G12.
G20, G20, right?
Oh, G20.
G20.
The
Sorry, I thought
G20,
you
yeah,
said G12.
the G20. So
G20.
that's the thing.
Okay.
We are seeing the good and the bad that's going to happen, but essentially, we just all want this over. We just all want that we
Yes, of
all want
course.
this virus, just dead. Stop killing people. Stop infecting people, because as long as it's there, and it's infecting someone who can go on with his life not knowing that he has it, can still spread it. So we just really have to kill it, and hopefully be a better society, be a better world, be better people, and
Yes.
be more prepared, and be more smart, I think, in dealing with this.
And in the
Yeah.
mhm.
Mhm.
And I think
And I would like to,
be more, not patient, be more understanding of the limits,
Of each other.
yeah, of the world, of and also try to help. This is the time that
yeah,
we,
yes,
just set aside or the
try to,
differences.
Mhm.
yeah, not only that, try to help. Like I said earlier, we are responsible for, the health and safety of each other right now. And I would like to appeal, to those people to please stop price gouging. Okay?
Mm.
It is disgusting that there are people who would take advantage of prices just to earn and make a quick buck.
Mm-hmm.
That is disgusting. And this panic buying. Why the hell would you buy? I mean, get all the toilet paper
We don't have that problem
and
here.
Mhm.
you
Okay.
we have that.
Yeah.
You cannot show those toilet papers in your all at the same time. Please don't do that. Stop the uh, panic
I
buying,
think that's
hoarding.
that's one thing, right? For discipline, and then
Toilet
to
paper?
Discipline and
Seriously?
discipline, and then another is probably the government and the local governments, the
discipline
municipality.
and discipline and being
Discipline.
considerate.
Correct.
I
Yeah.
think being considerate.
Then we also
Yeah.
think
Yes.
about that. Like, for example, we have this foresight. Okay, there's gonna be panic buying. How are we going to deal with this? Like, how are we going to make sure that there's enough for everyone? Because we are
Everyone.
sure that
Yes.
people are going to hoard. So that's
Mhm.
one thing. I've seen a lot of videos from different countries. It was so sad that I saw that old man. there's empty shelves, and he was doing the grocery alone, and he couldn't find anything. That's sad, but it's the reality of life. People panic. So I think one other thing that we need to learn from this is how to address that, how to stop people from panicking, or how to manage, the fact that people will panic. So there, and I think the what another essential thing is communication. I think there's a lot of improvement in communication because we have social media, we have the internet, but it can definitely still be improved. I think more facts, more information, readily available, real time information that is intuitive, something that can be easily understandable. Like
Yeah, let's
it's
Yes.
not. What is
yeah.
that? What did you just
Let's
say? Why?
let's let us prioritize spreading, sharing um, information and uh, sources or resources. Prioritize that over um, spreading, sharing, posting your cynicism, your criticizing.
Mm-hmm.
Again, I'd like to put emphasis on the difference between criticizing and critical thinking. Know the difference between cynicism and activism. Do not confuse, okay?
Mm-hmm.
Please, because you're not helping. Stop wasting your time on posting, instead, help propagate information that the people need. Like, where do they go? What are they supposed to do? Who they should go to?
Yes.
Help your government, your local governments, to spread this information, not misinformation. And then after that, then all right, then fine, go back to posting whatever you want. You want to criticize, you want to curse everybody because your life is so miserable, whatever, but not right now. As a friend, as our mutual friend said, do it for the good of humanity.
Greater good. Yes.
Yeah.
Yeah,
Oh, Brian? I think we like. Hi
Am I
there.
back?
Yeah,
yeah,
you're
you're
back.
back.
Okay.
You're back. Okay, and now
Because
because.
my battery is 10% on.
Okay. All right. So
Okay, then I guess
wow,
we have to
truly,
wrap
this has
this up.
been just really very insightful. Thank you, Brian. Thank you, Tony. You'll find out for those listening. Thank you for joining us. Thank you for listening to our conversation, to our
Thank you,
discussion.
Joyce.
Thank you, Brian, and thank you, Tony. So I think Tony has a quote. Yeah, I think she's going to come up with a quote for
For
the
what?
day. Do you have anything there?
It's by what do you call this? Leo Tolstoy. I hope I said his name right.
Yes.
Yes.
The
And
writers.
he said, the writer, and he said, in the name of God, stop a moment, cease your work, look around you. There. So that's what I want to, share with you guys right now. Look around you, cease your work. Okay, take this
That's just
time.
perfect. That's perfect for what's happening
Yes.
right now. Seize the moment.
Yeah, spend time with your
Maybe
family,
that's something that we should,
no matter how much you want to
we,
kill.
right? We should all. But how am I gonna seize the moment right now? I mean,
And for me, I also have some words.
yeah. Go ahead, Brian.
This is
Yeah.
actually I take away from the movie. I just watched the Netflix movie. If you're familiar with the platform,
No, not yet. We were
Oh,
supposed to watch that,
we
but
were supposed
we
to
watched
watch
something
it.
it's
else.
Yeah.
yeah. But my takeaway from that movie is that wealth is
Mm.
nothing without sharing it. But make sure that when you share it the right way. So
When you say share the right
that's my
way,
take.
yeah, I haven't watched it. Is it because if there's another intention, there's a
That
different intention
is,
when
You
you
have to
share
watch the
something?
movie.
Okay, I won't. All right.
You have to
I,
watch the
I love
movie.
You
I
love,
love
yeah,
what Brian
said.
I love what Brian just said. You share it. So the first thing that first thing I thought of is Jeff Bezos, Amazon, share.
Mhm.
Okay? I mean, you are sharing, but maybe you can do more.
Yes.
Yeah, okay.
Maybe you are the wealthiest man on earth right now. Maybe you can,
Well, he has. He has. He
share
has.
more.
Okay. Yeah. I get it. I get it. There's just so much more
Amazon.
responsibility. There's more expectation from you when you know what it means when you have more. Then a lot is expected from you as well. Again, thank you very much for joining me. Thank you, Brian. Thank you, Tony. So
Thank
stay
you, Joy.
safe.
Thank
Stay
you.
safe, guys. And let's look back at this and
Keep
finally,
safe.
yeah, everyone keep safe and wash your
Spread
hands.
positivity
Yeah.
Yes.
always.
Okay.
Spread positivity.
All right. Thank you, guys. Thanks for joining us. Bye bye.
Thank you.
Thank
Bye.
you. Bye.